How to talk about chronic fatigue energy limits to family. Talking about energy limits with family members can feel tricky, but clear and compassionate communication makes a big difference. Start by explaining that chronic fatigue syndrome is a real biological illness that causes severe, unrelenting fatigue that does not improve with rest. It also brings symptoms like brain fog, muscle pain, dizziness, and sometimes sleep issues, which can change unpredictably from day to day. Emphasize that this is not just feeling tired but a serious condition that impacts daily activities. Even simple tasks like cooking or showering can become challenging. Introduce the idea of managing energy carefully through pacing, often called the energy envelope concept. This means the person with chronic fatigue has a limited amount of energy each day. They need to balance activity and rest to avoid worsening symptoms or triggering a flare-up called post-exertional malaise. Explain that going beyond these energy limits can cause setbacks, which might mean days of needing to rest extensively. It's important for family members to understand that these limits are real and not always visible. Share examples to help illustrate how symptoms can vary. One day, they might feel well enough to join a family meal or outing, but the next day they might need to rest for most of the day. Encourage family members to ask questions and express their feelings. This openness helps build empathy and understanding. Suggest finding activities everyone can enjoy that respect these energy boundaries, like watching a movie together or doing a quiet game. Acknowledge that living with chronic fatigue can be emotionally taxing for everyone involved. It's normal to feel frustrated or worried, but keeping communication open and flexible helps everyone adapt. Reminded family members that mental health support can be helpful, as living with a chronic illness can sometimes lead to anxiety or depression. Encourage patience and teamwork, emphasizing that managing chronic fatigue requires ongoing understanding and support from everyone. Finally, reminded your family that medical advice from healthcare professionals is essential. Each person's experience with chronic fatigue syndrome can be different, so personalized guidance is key. Respecting individual needs and limits, and working together as a team, helps create a supportive environment where the person with chronic fatigue feels understood and cared for. By sharing clear information and fostering open dialogue, families can better navigate the challenges of energy management and help improve quality of life for everyone involved.